Hello friend, welcome to the channel Pharmacy Dictionary. Today's lecture is going to be the last part for the route of drug administration, and in this last part we will conclude different other route of drug administration which are not as important as we have discussed earlier, but these are also important in some case. So let's start today's topic with the intraperitoneal route of drug administration. If you are a student of B Pharmacy 5th semester or 4th semester, then you must know about this. There are so many experimental animals in which we have to perform the different experimental protocol, and for them there are so many other route of drug administration which are mostly not applicable for the human being, and this intraperitoneal is one of them. We can use the intraperitoneal injection in infant, but it is not applicable for the adult patient most of the cases. So in intraperitoneal route of drug administration, we have to administer the drug of desirable activity into the peritoneal cavity, and this is having so many advantages, like this will provide larger surface area. As I have explained, this will provide large surface area. What is the relationship between the large surface area, and we can understand by this point only. See, wherever we applied any drug, just for example, I am talking about a topical. See, this is a topical area, but if we'll apply a drop of cream or ointment over the one part and leave it as such, then it will not absorb that much effectively. But if I will spread that particular drop of ointment or cream throughout the area which is possible to be spreaded, then it will produce more effect. That means any absorption of drug or any absorption of any dosage form will be increased if we increase the surface area. That is, the absorption is directly proportional to the surface area. So in this case of intraperitoneal route of drug administration, there will be a larger surface area for the absorption of drug which was given by injection. This is main advantage of this route of drug administration. So second point says about this, that fluid are injected intraperitoneally in infant. In case of infancy, we can administer the drug like fluid or different types of replacement therapy in this route of drug administration with the help of this kind of needle and syringe. That will be a very effective for the treatment of desirable activity. Now coming to the next route of drug administration, that is intrathecal. Intrathecal is a route of drug administration which is preferred in case of general anesthetic, and you know it very well. General anesthetics are those agents which are used to prevent the sensation of pain that will be reversible for short term, being up to the duration of action for that particular drug. So in this case of route of drug administration like intrathecal, drugs are injected into the subarachidonic space for the action on central nervous system. We have to inject the drug on subarachidonic space so that it will produce its effect up to the CNS level, and you know it very well that central nervous system stimulant and depression are those category drug. Even the general anesthetic can also inhibit the sensation of pain that will affect on central nervous system. So in that case of intrathecal route of drug administration, spinal anesthetic and few cases of antibiotic and corticosteroids can also be introduced via this route of drug administration. Now next one said, important note, we have to keep this thing into our mind while selecting this kind of route of drug administration like intrathecal and intra-articular also, so that it says strict antiseptic precaution is must, like sterilized condition we are talking about. So if you are interested to administer any of the drug of suitable dosage form in intrathecal route of drug administration, that drug, that syringe and needle and all those utensils which are used in this process has to be completely sterilized. That should be completely antiseptic precaution that must be taken, and all those precaution is essential because that will go through the parenteral route of drug administration, and that will be a problematic for patient if you have not bothered about the safety precautions. Now next one is intra-articular. It's not intra-arterial, just keep this in mind. Intra-articular, that means we have to introduce the drug which are injected into the joint for the treatment of arthritis and other disease of joint. In case of arthritis, specifically rheumatic arthritis, there is a condition of inflammation, that is autoimmune disorder. So in that case, to reduce the particular type of inflammation, we have to introduce a drug via this intra-articular route of drug administration. In that, a needle is inserted between the joints of shoulder or knees or whatever you are expecting to get therapeutic effect from that route of drug administration. So this will be go through the joint, and that will relieve the pain of rheumatic arthritis and different types of other other disease of joints. Example, hydrocortisone is very important in the treatment of rheumatic arthritis because that will reduce the inflammation. And you know it very well that rheumatic arthritis, in this case there is a autoimmune disorder as well as there will be inflammation and there will be severe pain along with the head heat and redness. So in that case our hydrocortisone will be the drug of choice and the route of drug administration will be intra-articular most of the cases. Coming to the next one, the intra-arterial. Now see the difference, intra-articular and this is intra-arterial. That means there are two types of blood vessels in our body, arteries and veins. We have seen about the intravenous IV route. Now it's talking about the arterial route of drug administration, but that route of drug administration is not preferable as compared to the other one because it is having some kind of limitation. But let's see the different points regarding this. The first says drug is directly injected into arteries. It is very difficult to find the artery because it is in deeper side. So this is little bit difficult, but in this case we have to administer the drug with the syringe and needle directly to the arteries part. Now next one says this is only used in, it cannot be used for each and every condition. It is limited to some cases. These are peripheral vascular disease. If you are having different types of vascular disease, then we can go through this route of drug administration. If you need local malignancy treatment, then we have to treat these conditions via this route of drug administration. And if you are about to diagnose the different types of angiography, then you have to go for this route of drug administration for the diagnosis purpose. That is why it is written as a diagnostic study like angiogram or angiography, because that result will be converted into a gram and the process is called graphy. So the last one say the last route of drug administration is intramedullary. This is nowadays not in use, but in this case we have to introduce the drug of choice into the bone marrow. So this will produce its effect, but right now this is not preferable. This is very rarely used route of drug administration. So friend, with this other route of drug administration we have concluded and finished our route of drug administration topic. I hope you will get all the points. I have make this topic very lengthy because this is very important for each and every semester and these are the basics. So I am not worried about the time, I am worried about your concept. I tried to clear your concept. I hope you are getting my point. So at the last, thank you very much for watching this video. If you want to take the screenshot of this whiteboard, then you may have up to some time. Please do take care of yourself and please give us your feedback in comment box. Thank you.